The release of new guidelines around therapies for people suffering from ME and chronic fatigue syndrome has been put on hold as NICE, the National Institute for Health and Care Excellence, says it can't agree on a document that's supported by all. In fact, 3 members of the review panel have actually resigned, and NICE say that they need some time to consider their next steps. Well, I can talk now to Dr. Alistair Miller, consultant physician in infectious disease and internal medicine. Good morning.
Good morning.
Do you understand what the controversy is about here and why NICE have been unable to agree these guidelines?
Yes, I think I do. There's long been the approach to CFS ME has, since 2007 guidelines, been using cognitive behavior therapy and graded exercise therapy as the therapeutic approach for this condition. And there have been certain members of the patient community and charities who are deeply opposed to that approach. But it has served us well for the last 20 years or more, even before 2007. It is the approach that is used in all NHS CFS clinics, and my understanding is that NICE were going to advise against it and have now changed that position, which is very good news for all of our patients, although I realise that some of the charities and patient advocacy groups may be disappointed by the pause.
And we'll be talking to one of them in a moment. Graded exercise therapy is asking patients to take a little bit more exercise every day in order to try and build up their tolerance. CBT, obviously, people object to the idea that suggests that the illness that they're suffering from is in their mind rather than a physical illness.
Sure. Well, I think there are 2 really important points there. First of all, graded exercise is, as it says, it's graded. It is not telling patients just to go out and go to the gym and blast the condition out of their system. It's a properly regulated incremental increase in exercise supervised by a trained physiotherapist or occupational therapist or other clinician. So that's really important. And secondly, the business saver CBT, and I think that was the sort of lead point in the Guardian article today, the fact that most clinicians would support the use of CBT for CFS ME does not in any way imply that we feel it is a psychological illness. The reality is that CBT helps symptoms. It helps symptoms in people with cancer. It helps symptoms in people with rheumatoid arthritis. And CFS ME is very much a symptomatic condition. If you don't have the symptoms, you don't have the condition. And if CBT can help the symptoms, and there are lots of trials to show that it can, then it can obviously improve the situation. So to take those 2 therapeutic options away would be an absolute disaster for our patients.
Dr. Alistair Miller, thank you very much for that. We can turn now to Sonia Chowdhury, who's she is the Chief Executive of Action for ME, a charity for ME sufferers. Good morning.
Good morning.
Dr. Miller was telling us that to take away these treatments, graded exercise therapy and cognitive behavioural therapy, would be a disaster for patients.
Well, first of all, the guideline, the embargoed copy, was not actually taking CBT away. It was acknowledging that it wasn't curative and that it had a place in supporting people live with the illness. It's not just the patients.
So you support the use of CBT for ME and chronic fatigue syndrome patients?
We support it for helping people to live with the illness and cope with the symptoms. It is not a curative treatment. It's not just patients and charities that are saying that we don't want it. The evidence shows it is not effective.
And so are you concerned that the guidelines that NICE were going to publish have been indefinitely, as far as we know, paused for just now because they can't agree on it, and that this means that there will not be a change in treatment for patients until they come up with new recommendations?
Absolutely. We frequently hear from children and adults who have been made worse by graded exercise therapy, and but also those who have been able to better manage this life-changing condition because their GP listened to them and worked with them to manage their symptoms through careful energy management, which is what the draft guideline recommends. We do not want people to continue suffering, and the guideline was produced on the back of evidence through an expert committee who worked for 3 years and responded to every single piece of consultation, including from the Royal Colleges. So we just don't understand why that's been delayed now.
But are we any closer to anything that could come close to being a curative treatment as opposed to just trying to help manage people's symptoms?
There is nothing at the moment in terms of a curative treatment. That's because of the woeful lack of investment in research over the many, many years. So we're calling for more biomedical research so that eventually people with ME can have the treatments they deserve.
Sonia Trowdry, thank you very much for talking to us.